Hello, and welcome to today's Blue Health Equity Virtual Roundtable. I'm Reed Melton, Vice President of Clinical Operations at the Blue Cross and Blue Shield Association, and thank you very much for joining us today. Today we are addressing a vital topic that impacts all Americans: racial health disparities, specifically in maternal health. Joining us to speak on this issue are four women who are deeply involved in racial health equity and maternal health disparities, each bringing a different perspective. Kim Keck, who is the President and CEO of the Blue Cross and Blue Shield Association, whose 35 independent companies cover 1 in 3 Americans and are responsible for approximately 25% of the babies born in the US each year. Stacy Stewart, President and CEO of the March of Dimes, one of the longest running, most important infant and maternal health advocacy organizations in the world. And Stacia Cohen, Executive Vice President of Health Services for Care First Blue Cross Blue Shield. Care First is responsible for a number of highly successful maternal health programs in communities in Baltimore and throughout the Mid-Atlantic. Also joining us is Dr. Jackie Walters, an OBGYN who has practiced for more than 20 years and is a nationally recognized advocate for Black women's health. Dr. Jackie will offer her perspective on maternal health from the front lines. Each speaker will have an opportunity to provide their own perspective, and then we will turn to Q&A and discussion. Kim, how about you start us off and tell us about Blue Cross Blue Shield's exciting announcement today?
The association is today announcing a new national health equity strategy to confront health disparities and really reimagine a more equitable healthcare system. Good health shouldn't depend on the color of your skin or the neighborhood you live in, but too often it does. And that's just unconscionable and totally unacceptable. Blue Cross and Blue Shield companies across the country have made great strides to advance health equity work in our local community, but there's so much more to do. As part of the strategy, we're setting bold goals and holding ourselves accountable. We're collaborating closely with national, community, and state experts because it will take all of us to change the trajectory of health disparities. Advocating, for example, for national standards for collection of race, ethnicity, and language data to measure disparities is important because we can't manage what we cannot measure. We're targeting interventions to specific chronic conditions that plague communities of color, like maternal health. We're providing training and incentives to close gaps in care and address unconscious bias in culturally appropriate care. We're advocating for public policies at both the state and the federal level to address equity and access issues, like the Momabus package, and amplifying CDC's initiatives addressing that, in fact, racism is a public health threat. And more recently, the White House's first ever proclamation on Black maternal health. So far this year, we've been supporting vulnerable communities in the fight against COVID with vaccine efforts to get the vaccine distributed equitably to seniors living in socially vulnerable zip codes. Our first focus on health equity strategy is maternal health. We've set a goal to reduce racial disparities in maternal health by 50% in 5 years. This is so important because we have a Black maternal crisis in this country right here, right now. And many Blue Cross Blue Shield plans have started work to think about how we can prevent and really avoid these dangerous outcomes. Doing things like identifying women at risk, providing one-on-one coaching to manage chronic conditions during pregnancy. We're offering prescriptions for healthy food delivery and nutrition counseling. We're helping address the underlying social determinants that can have significant impact on health. We're also providing doulas to support mothers along their journey, building access to health caring, which is a lot bigger than health care. So to address racial disparities in a more meaningful way, though, we must bring more people to the table to create lasting change. That's why we've convened a national panel of doctors, public health experts, and community leaders to counsel us. This strategy, in fact, builds on a pledge that Blue Cross and Blue Shield companies made last year, and it's part of essential work to fight systemic racism. We want to build more equitable communities, more equitable system of health, not just for 110 million Americans, but for all Americans. Starting here, starting now, we can begin to put an end to racial disparities in healthcare. I'm excited to hear from other panelists to continue this conversation.
Now let's hear from Dr. Jackie Walters. As I mentioned, she could not join us in person today, but she is presenting her ideas via video.
I'm Dr. Jackie Walters. I'm a practicing OBGYN in Atlanta, Georgia, and a cast member of Married to Medicine. Every day in my practice, I care for patients who want what we want: healthy moms, healthy babies, and healthy communities. But as you may know, it's not acceptable that Black women are likelier to experience childbirth complications or deliver prematurely or have C-sections. So I'm encouraged that Blue Cross Blue Shield Association is making a meaningful pledge to reduce racial disparity in maternal health by 50% over 5 years. What I see in my practice is this: Black women are afraid they'll die in childbirth. They're afraid that they won't be listened to or taken seriously when they say there's a problem. But this has to be a joint effort. It's a doctor like me, it's women educating themselves, and it's health insurers participating in the solution. That's where Blue Cross and Blue Shield companies are coming in, providing more support for women with the kinds of chronic conditions that can be dangerous during pregnancy or childbirth.
Stacey, would you like to share your perspective on maternal health equity based on your deep experience and knowledge on this issue?
Absolutely, Reed, and thank you for having me today, and thanks for that introduction. I am Stacey Stewart, and President and CEO of March of Dimes, and it's days like today that really give me a lot of hope and create a lot of excitement. To be with you all as we launch this national health equity strategy, it's really important because it is time, it's beyond time, for us to all work together to address the health disparities that we see entrenched in all of our healthcare institutions. It is our strong belief that there is no zip code, no mother's socioeconomic status, no mother's educational level that should determine whether or not she can have the healthiest pregnancy possible. Today, though, unfortunately, the U.S. is considered one of the most dangerous developed nations in the world in which to give birth. The U.S. is facing an ongoing maternal and infant health crisis. And in 2021, we are facing a crisis like we've never seen before. And this is probably made only worse in this current pandemic. Each and every day in this country, 2 women will die as a result of pregnancy and childbirth related complications. 2 babies die every single hour. And what's worse, the majority of the women and babies who die are babies and moms of color. In fact, what we know is that there are significant racial disparities in maternal and infant health in this country. We also know that 60% of all the maternal deaths that happen are preventable, and that's coming from the CDC. Black women are 3 times more likely to die as a result of pregnancy-related complications as compared to white women. Among American Indian and Alaska Native women, they are about 2.5 times more likely to die as a result of pregnancy and childbirth as compared to white women. At the March Times, as you all know, we do a lot of research. We do a lot of data analysis and collection. In September of last year, we did an update of a study that we originally did in 2018. It was our 2020 Maternity Care Desert Report. It was called Nowhere to Go. And what we found as the update in 2020 is that about 54% of all counties in this country have limited or no access to maternity care, affecting about 7 million women of childbearing age. Over half of the counties, if you can imagine, have little to no access to obstetric care. This also affects 1 in 8 babies that are born in these areas, about 500,000 babies that are born. And women of color represent about 35% of the women of childbearing age in these areas where there is limited or no maternity care. Women of color are up to 50% more likely to give birth to a baby prematurely, and their children can face a 130% higher infant death rate. These disparities in preterm birth have increased over the past several years. So that's why I'm really, really just so thrilled to join Blue Cross Blue Shield and all the companies of Blue Cross Blue Shield on this really ambitious but very important commitment to make sure that we give moms and babies the help they need now and the help they need the most.
Thank you, Stacey. Stacia, let's hear from you about how maternal health programs in a local community can truly make a difference.
Thanks, Reed. Hello, everyone. I'm Stacia Cohen with Care First Blue Cross Blue Shield. We're the largest health insurer in the Maryland and DC region. For more than a decade, we've been supporting a massive citywide effort in Baltimore to improve infant and maternal health. That initiative is called Be More for Healthy Babies, and it's made a dramatic difference in outcomes for Black infants and mothers. It's been hyper-focused on 2 neighborhoods with disproportionately high infant deaths. Thanks to this work, between 2017 and 2019, there were no infant deaths in these neighborhoods. So community partnership is essential. At the health plan, we also identify women who might be at risk of pregnancy complications and reach out to them as early as possible in their pregnancies to offer support. This includes working with their doctors to make sure they're getting comprehensive care. We find that what's really working is paying doctors for the quality of care that they provide and not the quantity of care. That gives doctors the flexibility to provide moms what they need. For example, we know Black mothers are much more likely than white mothers to have pregnancy complications, often from chronic diseases. These kind of payment arrangements encourage doctors to focus on the best outcomes for moms throughout their pregnancy and childbirth, and it's an incentive to focus on prevention and management rather than treating more serious problems down the road. We're also working to make sure we can care for whole people, not just during childbirth, but a woman's mental health, her health before her pregnancy, her social needs. We're looking at our data, and we're working with our providers and our community partners to identify ways we can support moms in more effective and different ways. One of these has been to partner with the highest volume labor and delivery hospital in Maryland. We want to meet moms and families where they are and in the ways and in places that are meaningful to them, their families, and their communities.
Stacia, thank you so much. Stacy, you just shared some alarming stats. You said that 2 women die of pregnancy or childbirth complications every day, and that most of those deaths are preventable, and that 2 babies die an hour. The majority of those women and babies are women and babies of color. We're talking about 20,000 infants a year. That means 50 times more babies die annually than the people who died in the 2 tragic plane crashes that grabbed headlines for months. We all know that we need to make these occurrences ground the plane moments. Kim, can you tell us how Blue Cross Blue Shield is going to make that happen?
It is incredible that this crisis is right in front of us. So look, I think we need to build awareness first and foremost, and that's what part of this conversation is today. But importantly, we need to sustain it. We need to create a sense of urgency to take bold, swift action. I was thinking about this the other day, and I thought, imagine if we could all come together to confront health disparities the way we did in COVID-19, right? 14 months ago, we found out we were living through this global pandemic. And if we think what's happened in that time, we mobilized research and development, testing, manufacturing, distribution to both develop and to administer vaccines in really less than a year. When at this point last year, I think some of us, at least I was, thinking it could take several years to do that. So imagine if we could do the same and mobilized with that all-in kind of effort and force to save more moms and babies.
Thank you so much, Kim. Stacy, March of Dimes plays such an important role in speaking out on maternal health and infant health. Can you share your perspective?
Sure, absolutely. A big part of, what we try to do at the March Times is to make sure that we, do everything that we can to support all of the different work that's being done to promote maternal and infant health. And I think, a lot of what we're trying to do is to make sure that not only are we working with healthcare providers, working in communities, working with federal and state policymakers on the kinds of legislative changes and policy changes that can move the needle on maternal and infant health as well. We've looked at a number of different programs that can help expand access to care, expand the ways in which to provide culturally competent care to many women. We certainly have been in support of efforts that Kim mentioned earlier, like Momnibus, where there is a comprehensive approach to looking at ways in which to expand perinatal care workers, for example, doulas and midwives, and make sure that they are compensated and recognized for the value they bring to moms and babies and to improving healthcare outcomes, all the way to things like implicit bias training.
Stacia, you described partnering with the City of Baltimore and many other organizations as a part of the Be More Healthy Babies program. Now, that program's been around and running for more than 10 years. So what can you share with us that will help us accomplish our goal of reducing racial disparities in maternal health by 50% in 5 years?
I would identify three things. First is gathering the data and understanding the hard truths that the data is telling us about disparities in pregnancies and birth outcomes in our local communities. Second, we can accelerate payment constructs and value and outcomes-oriented relationships with providers that specifically incent closing gaps in pregnancy and birth outcomes. Third, we can really work with communities to understand and address the barriers to healthy pregnancies and birth outcomes for women and infants of color at a hyper-local level. One size will not fit all. There will not be a single playbook. However, there are identified examples of best practices across the country that we can learn from, we can leverage, and we can try to scale to other areas.
Thank you, Stacia. Kim, turning to you and looking nationally, how is the Blue Cross Blue Shield system accelerating change?
Well, it's funny, Reed. I'm going to go back to one word that Stacia just used, and that word is community. Right? I think across the country, we're in a position to address the root causes of racial disparities from the ground up. I'm a big believer, I say this all the time, that community focus is in the DNA of Blue Cross and Blue Shield plans across the country. And it turns out we care for people in every single zip code in the United States. So our reach is great. Our opportunity to incent providers to focus on, I said earlier, health caring for health and not just health care is meaningful. I also think we can't do this alone. Both Stacia and Stacey said this earlier. And so we play an important advocacy role and really also a role in which we can learn from national experts and use their advice as we implement some of these solutions across the country.
You know, Dr. Jackie Walters spoke of the underlying need to better communicate and educate across providers, health insurers, and all stakeholders. Her comments reminded me of an amazing white paper titled Groundwater. It was issued by the Racial Health Equity Institute in 2019. And the white paper points out how systemic racism permeates all levels. And if you think about it, if you don't have healthy fish that's supported by a healthy lake, that's fed by the groundwater, that connective tissue, those aquifers that connect us all. Those are the challenges that we face in addressing whether it's maternal health issues or systemic racism or health equity across every quarter of the healthcare industry. So it is important that we focus on the groundwater. Can each of you take a moment and discuss how nationally this health equity effort will address the groundwater?
For years now, we've been talking about how health is more than the absence of illness, that health happens where we live, learn, work, play, and seek care. It's all very connected, and these all intersect to drive health outcomes, to drive health, or frankly, to drive health disparities. And if we're committed to equitable health outcomes for everyone, we will have to address the structural racial inequities that are driving health disparities that exist regardless of socioeconomic status, culture, or behavior, as they are caused by deeply embedded systems.
So we're doing a number of things, and I would say to get at that groundwater, we're identifying women who are potentially at high risk in their pregnancy and providing early one-on-one support. We're addressing food insecurity among pregnant women and improving prenatal nutrition. I think there's something like 14 programs across the country where we're connecting providers to this really important issue of implicit bias. I think it's in Michigan, we have 20,000 providers alone that we're touching there. We're also partnering with Scripps and all of us on national research, because as I said a moment ago, we need to increase people of color participating in research. They're incredibly underrepresented. And so this is an important component as well. Importantly, we have to scale these kinds of strategies because rolling them out in every state is what will help us get to this issue of the groundwater challenge.
Great. Thank you so much, Kim. Stacy?
Yeah, I just would add, to what Kim said, that if we're looking at the groundwater, it really suggests we are, as was mentioned, looking at root causes. We're looking deeply under the surface and what is really going on in terms of why these issues happen in the first place. And I think one of the things that I think Kim mentioned earlier is that we have to acknowledge that it is not race, but it's racism that is at the core of impacting and driving these health inequities that we see. It's not the fault of women of color and babies of color that they're facing these kinds of health outcomes. There is institutionalized racism and systemic challenges that didn't just pop up overnight either. And so, what I think is really important in this is that we take a step back, look at the historical nature of where we have been, understand how that's impacting us today, and start to root out the kinds of actions, the kinds of inaction, and the kinds of influences that need to be undone in order for us to get to a better place for moms and babies of color. And I appreciate the fact that we're at this moment in this country where we can start to reckon with this history and reckon with the impact today and start to move forward for a better future for all moms and babies, especially those of color.
Thank you all for a provocative discussion today. You can learn more about our commitment to reducing racial disparities in maternal health on our website, bluehealthequity.com. Kim, I'll turn it to you to provide some closing remarks.
Thanks, Reed, and thanks, everyone. Thank you, Stacy. Thank you, Stacia. I think what you can hear from us today is the commitment that we collectively share. The Blues, in fact, are all in on this effort. And as you heard many times today, we cannot do this alone. So I'm inviting you to join us to help build a more equitable healthcare system for the future. I like to call it a more equitable system of health and health caring. So now is the moment for us to come together. Thank you for joining us today, and thank you for moving forward with us.